Good morning. Topic for discussion is homograft in cardiac surgery. Look deep into nature and then you will understand everything better. Albert Einstein. Heart valves are marvels of natural engineering. Most people's last a lifetime. But when valves become diseased, they may need to be repaired or replaced. The types of bioprosthetic valves are the xenograft, which are the tissues from different species, porcine valves, bovine pericardium, etc. Allografts or homografts, they are tissue from same species, they are human valves. Autograft, tissue from same individual, pulmonary valve to aortic position. The homograft is a drift of tissue from a donor of the same species as the recipient. Now about the human tissue valves, Sir Dr. Donald Nixon Ross has given this statement. Although the homograft story goes back a number of years, it has progressively gathered strength and new adherents. I, for one, have never doubted its triumphant progress. Unlike man-made offerings, which come and go like the seasons, the homograft was conceived not on this earth, but in a celestial design center, with not just several years, but millions of years of background and testing. This makes it unlikely to be bettered now or in the future. Coming on the historical aspects of the homographs, in 1952, Lorne and his associate demonstrated that it was technically possible to transplant canine aortic valve homographs into the descending aorta of a recipient animal. 1956, Gordon Murray reported the use of fresh aortic valve homographs transplanted into the descending thoracic aorta for amelioration of the consequences of the native aortic valve insufficiency. In 1961, Doctors Bigelow and Hemibaker as the first critical insertion of an aortic valve homograft in the orthotopic position. 1962, the initial clinical use of aortic valve homograph was reported independently by Donald Ross of England and Sir Brian Barrett Boyce of New Zealand. Duran and Gunning developed a technique in the laboratory for implanting the aortic valve homographs utilizing a single running suture technique. Now coming on the uses of homographs, the homographs have multiple uses and they are very useful in the cardiac surgery. They can be used for the replacement of the aortic, pulmonary, mitral and tricuspid valve, replacement of the aortic root, replacement of repair of cusps of the aortic, pulmonary, mitral and tricuspid valve, for Ross procedure, adult and pediatric, vascular patch material, congenital heart surgery, like tetralogy of Fallot with pulmonary atresia or other complicating factors, truncus arteriosus, transposition complexes, double outlet right ventricle, coaptation repairs. In 1962, Sir Donald Nixon Ross did the first homograft on an aortic valve, believing biological tissue would last longer than its artificial equivalent, so it proved for 5 years. Later he expanded the approach by replacing the diseased aortic valve with the patient's own pulmonary valve in what becomes known as the Ross procedure. So Brian Barrett Boss of Green Lane Hospital in Auckland did the same operation independently. 1964, Barrett Boss reported his early experiences with aortic homograph in 44 patients with for good results in all except 3 patients. Worldwide, around 3 lakhs valve replacement are being done every year. There is a growing biological tissue valve segments, that is more than 50% and rising, increasing market up to 10 times in next 10 years because the aging population is increasing. There is increasing world population. There are more and more underdiagnosed patients in developing countries like India and China, which are being diagnosed now. Even the Asian market is changing rapidly. As we see, in 2001, there was only 5.4% patient who had tissue valve replacement, while in 2017 there was 15.3% patient. Now it is very clear from here that there is very little progress in the design of mechanical valves, and therefore we could not get rid of the complication of the prosthetic valve, which are mainly the instruct valve and the thromboembolic phenomena and hemorrhage. Then we see a very high incidences of confliction, that is hemorrhage and thromboembolism, which is related to the anticoagulation patients. Now we see with the use of tissue valve, there is reduced risk linked to reoperation. As we see, the risk with the emergency surgery or a blocked mechanical valve is 20%, while with the tissue valve it's only 1.5%, as in most of the cases it's a planned surgery. So the risk factors are emergency, the endocarditis and NYHA class 12. Now it is very obvious the warfarin is very difficult to manage, and warfarin leads to many kind of complications, and most of them are very fatal. Fortunately, with tissue valve we don't have to use warfarin for a long time. Coming on the homograph again, it is estimated that more than 50,000 homographs have been implanted worldwide so far, half of them between 1962 to 1974, not more than 1,500 between 1974 to 1995, possibly due to competition posed by the stented xenograph valve. Now this is a statement which was quoted by Sir Donald Ross himself, and he said that it is easy to anticipate, however, that the born-again enthusiasm will decline again unless surgical indication for the use of homograph valve are properly set. Expectation about the long-term performance of these valves are based on realities. The existence of the inherent complex biological tissues are recognized. So therefore we see the heart valves, ideal heart valve, have 10 commandments, and they are still counting. The most of the commandments which we see here is that it must not propagate emboli, it must be clinically inert, it must offer no resistance to physiological flows, it must close promptly less than 0.05 seconds, it must remain closed during the appropriate phase of the cardiac cycle, it must have a lasting physical and geometric features, it must be inserted in a physiological, the entail and the normal anatomical site, it must be capable of permanent fixation, it must not annoy the patient, it must be technically practical to inert, and we see that most of these criteria are fulfilled by the homographs. Even stented heterographs are nowhere near this, and mechanical prostheses satisfy only 2 or 3 criteria. Now this is the echocardiogram, and which is showing the flow of the blood through a bioprosthetic valve and a bileaflet valve, and we see that the flow through the bioprosthetic valve is much more physiological as compared to the mechanical valves, but tissue valves are still much better. The criteria used prior to collection of hemograph, this is showing that if we have to develop a homograph valve bank, we have to have certain criteria, like donors, age should be less than 55 years, donor should have no infection or communicable disease, collection should be less than 24 hours after death, no evidence of HIV, HBV, HCV or syphilis, persons who have received an organ or tissue transplant, hemophiliacs who have received human-derived clotting factor should not be taken as a donor. Now, procurement of homograph valve. Now, homograph valve can be taken from a beating heart donor in an operation theater, or non-beating heart donors from a clean mortuary. Beating heart donors are the multiple organ donors, heart transplant recipients, etc. Non-beating heart donors are usually the post-mortem in the mortuary. Now, technique of sterilization and preservation and uses, mainly 2 alternatives are applied. Number 1 is the cryopreservation. Number 2 is the fresh wet storage at 4 degrees centigrade after antibiotic sterilization. Now, this is briefly showing how to harvest a valve. The heart is harvested with aseptic precaution, gentle rinsing of heart with 200 ml of normal saline solution. Blood is collected from donor's heart and tested for HIV, HCV, SBSAG, trichonoma pallidum and blood group. Dissection of allograft with aseptic technique under laminar flow carriage. After dissection, placed in a sterile hang solution containing antibiotic solution for 72 hours. Cefotaxime, lincomycin, vancomycin, amphotericin B and polymyxin B. Now, this is showing the thawing of the procedures, that is after cryopreservation. For thawing frozen allograft in its container is taken out, placed in container containing 2 ml of solution at 40 degrees centigrade. After 20 minutes, graft is placed in 50 ml of the RPMI plus 5 milliliter of fetal cough serum, and it is washed with saline and it is ready for use. This is showing about a heart valve bank with preservation facilities. Now at GB Pant Hospital, in a period of 1989 2018, which is almost the 30 years experience with homograph aortic valve, the 75 patient satisfactory early late result ideal for Indian patient. This is showing the scallop technique to its implant with the homograph aortic valve. We had 55 patients. Early mortality was 2, late was 2. Good long-term results. Now these are the homograph aortic valve. They can be used for the root replacement techniques. We used in 20 patients. Early mortality was 1, late death. Long-term results were good. Various studies confirming good long-term results of antibiotic sterilized solution is Yakub M. in 1986, who reported the 92% freedom from valve failure. Djokovic, the aortic root replacement using antibiotic sterilized fresh unstandard homograph valve, and the annulus inflammation reported 43 patients with antibiotic sterilized homographs in repair of aortic calcium of the ascending aorta. J.K. Ross in 1966 showed a follow-up of 11 years and 90% freedom from reoperation in 5 years. Yakub in 1966 shows a 10 years more from valve with very good results. GB Pant Hospital, we also use the homograph mitral valve replacement for 2 patients, no hospital mortality, 1 led death due to endocarditis. Now, autograft valves that are transplanted from one position to another within the same person, and as we see, the pulmonary valve is harvested, and then pulmonary valve is implanted in aortic position, and then the pulmonary valve is replaced by the homograph valve. At Pant Hospital, in 30 years period, We had done 22 years patients who had 46 ROS procedure, and they have very good results. And then there were two operative deaths. Both patients had aortic root abscess undetected in pre-op echo. Freedom from thromboembolic episode was 98%. Freedom from endocarditis was 99%. All patients were in NYHA class 2. Now, pulmonary autograft ROS procedures, the most of the series which are present showing very good results are L. Helis and Duran. They reported their experience in 78 cases, and these patients have very good results. Now, at Jeev Pant Hospital, we also performed the ROS2 procedure in 5 patients. These patients, the pulmonary valve was stented with a stent. There was no mortality, no failure. Good early and long-term results. So we may summarize key points. Then mechanical valves, they still represent a significant portion of the valve replacement market. All mechanical valves require lifelong anticoagulation, and warfarin is their only option. Warfarin is one of the most difficult drugs to manage, and its risk and drawbacks increase dramatically as a patient ages. The guidelines have leaned in favor of tissue replacement. Now, we summarize the homograph valve are the best substitutes and suited to Indian population. The cost is negligible and the quality of life is excellent. Long-term results are in excess of 20 years. Homograph valve blank with antibiotic sterilization, technical and easy to establish.